Hello everyone. Welcome to Ultrasound Made Easy. Case study. A male patient, 35 years of age, reports to the ultrasound unit, presenting clinically with difficult micturition. Then an ultrasound is requested. An ultrasound is a test that uses sound waves to create a picture of what's inside your body. When this test is used for bladder issues, it can help a doctor figure out the cause. This non-invasive test is usually performed on a full bladder, but it shouldn't be painful. The results of this test are used by a doctor to come up with a diagnosis and treatment plan to help relieve your symptoms. Ultrasound, or sonography, uses high-frequency sound waves to help diagnose all sorts of medical conditions. As the sound waves hit things like soft tissue, fluid, or bone, the waves are reflected back to the transmitter to create a simple two-dimensional image. A bladder ultrasound is done when a doctor needs to closely examine the structure or function of your bladder. The bladder is a muscular sac that receives urine from your kidneys, stretching to hold the fluid until you release it during urination. Bladder control, or your ability to control these muscles, makes urination a planned and purposeful task. However, there are many issues that can complicate the process of urination. Whether you have the test done in an examination room or an imaging center, the process will be similar. Make sure your bladder is full. While this can make the gentle pressure applied during the ultrasound a bit uncomfortable, a full bladder can help shift other organs, like the bowels, prostate, to get a clear picture of the bladder. Sound waves also travel better through fluids, so a doctor can get a better picture when these beams travel through a full bladder. Get undressed. When your doctor or technician is ready to begin the test, you will be asked to remove your clothes, or at least your pants and underwear. You may be given a hospital gown or drape for the test. Get in position. You will need to be lying down for this test. Gel is applied. Your technician will apply gel to the skin over your pelvic area. This gel helps transmit the sound waves from the transducer, or ultrasound probe, into your body. The scan begins. You will not feel the ultrasound waves as they are beamed inside you, but you may feel your clinician moving the transducer across the surface of your skin between your belly button and pubic bone in order to examine the entire bladder. See your bladder. The sound waves will produce a whooshing sound and display live images of the inside of your bladder. You may be able to see these pictures during the test. The technician will record samples and still images for a specialist to review. Done. When all the images are collected, the technician will wipe the gel from your skin, and you can empty your bladder and get dressed. Simple types of bladder ultrasounds, called bladder scans, can deliver immediate results. These scans are usually used only to measure the amount of urine in your bladder. A diagnostic bladder ultrasound produces more complicated images about the size, fullness, and lining of the bladder. The results of this patient reviewed a smooth homogeneous prostate gland of normal volume, etcha texture and borders, but with a urinary bladder of thickened walls, 6.4 mm. Urinary bladder wall thickening is a common finding, and its significance depends on whether the bladder is adequately distended. In both adults and children, the wall may be considered thickened on ultrasound if it measures greater than 3 mm when distended, with greater than 25% expected volume. Greater than 5 mm when non-distended, with less than 10% expected volume. Normal adult bladder volume is 300 to 400 milliliters. Diffuse bladder wall thickening, in this case and other similar cases, may be suggestive of 1. Bladder outlet obstruction. 2. Neurogenic bladder. 3. Infectious cystitis. 4. Cystitis from radiation or chemotherapy. 5. Ketamine-associated lower urinary tract dysfunction. A doctor might understand what the ultrasound is showing, but a radiologist will typically interpret the images and write a report for your doctor to review. The doctor will make an official diagnosis after an ultrasound based on the report from the radiologist. Apart from overactive bladder, a bladder ultrasound may also be able to help diagnose bladder cancer. After a diagnosis, the doctor can begin treatments or therapies to help your symptoms, such as medications or pelvic floor exercises. Sometimes, more testing may be needed. Great. Thanks for watching. Lord Jesus be glorified. If indeed this lesson impacted you with knowledge, please